The psychiatric mental health nurse practitioner, PHMNP, presents data showing that a new approach to patient care has better outcomes. However, members of the staff are almost all in disagreement and spend considerable time arguing that the data are in error and providing rationales for maintaining the current approach. This is an example of A. Prejudice. B. Aggression. C. Debate. D. Groupthink. The correct answer is D. Groupthink. This is an example of groupthink. Groupthink occurs when maintaining the status quo is more important to members of a group than making a reasoned or good decision. An effective method of handling diversity in the workplace is to A. Act as though everyone is alike. B. Develop different standards of performance for different groups. C. Develop internal support systems. D. Attempt to solve problems quickly. The correct answer is C. Develop internal support systems. An effective method of handling diversity in the workplace is to develop internal support systems. Diversity should be recognized and valued rather than acting as though everyone is alike, because that standard usually means that people are expected to conform to the prevailing majority culture or group. It is important to ensure all individuals are treated in a fair manner. Problems related to diversity can rarely be solved quickly, so dealing with diversity must be an ongoing process rather than a once-a-year diversity workshop. The PHMNP works in a community in which many people are uninsured or underinsured. The impact on healthcare is most likely that many of these people will A. Access healthcare but be unable to pay bills. B. Postpone healthcare until a crisis occurs. C. Seek alternative forms of healthcare, such as a free clinic. D. Organize to demand better healthcare. The correct answer is B. Postpone healthcare until a crisis occurs. If the NP works in a community in which many people are uninsured or underinsured, the impact on healthcare is most likely that many of these people will postpone healthcare until a crisis occurs. This often results in more expensive care and greater need for care. The PHMNP is involved in a population-based nursing intervention program. Population-based interventions are aimed at A. Vulnerable or underserved subgroups within the larger population. B. All members of the population in an area. C. Population members who lack health insurance. D. A specified number of individuals in the population. The correct answer is A. Vulnerable or underserved subgroups within the larger population. Population-based interventions are aimed at vulnerable or underserved subgroups within the larger population. For example, a program may be tailored to the needs of an immigrant population or the homeless. These subgroups often have health disparities and need both health care for existing problems and preventive measures to prevent illness. An outpatient with a long history of recurrent depression has depended on his mother for his support system, but his mother has recently entered an assisted living facility and is in poor health. The PHMNP should A. Provide the patient with lists of community agencies. B. Assure the patient that he can manage independently. C. Remind the patient that the nurse practitioner is part of his support system. D. Assist the patient to identify other support systems. The correct answer is D. Assist the patient to identify other support systems. The NP should help this patient to identify other support systems, because patients often view support from a narrow perspective. Support systems may include other family members, neighbors, friends, religious organizations, support groups, and community agencies. From the perspective of risk management, an incident that would be classified as a serious incident includes which of the following? A. A patient falls and sprains her wrist. B. A patient complains that staff are rude. C. A patient commits suicide. D. A patient is raped by another patient. The correct answer is C. A patient commits suicide. Serious incidents include interruptions of treatment and minor injuries that would not require hospitalization. Service occurrences include minor damage to equipment or property and inadequate provision of care. Sentinel events involve unexpected death or permanent physical or psychological injury and include suicide and rape. The three primary components of risk analysis are 1. Assessment, 2. Intervention, and 3. A. Analysis. B. Deliverance. C. Communication. D. Performance. The correct answer is C. Communication. Assessment, gathering and analyzing data through a variety of means. Intervention, using data to make changes in order to reduce risk. Communication, publishing or sharing results with various key stakeholders, including administration, staff, patients, families, and the general public. Risk analysis may be carried out to assess individual risks as well as risks associated with different treatments or programs. All new treatments and/or programs should undergo risk assessment. The PHMNP plans to replace one screening instrument with another that is available free of cost, but to determine whether the screening instruments are equivalent, the nurse practitioner administers both the old and the new instruments and assesses whether positive correlation exists. This type of testing is A. Convergent, B. Divergent, C. Predictive, D. Multi-trait, multi-method. The correct answer is A. Convergent. This type of testing is convergent testing. If there is no positive correlation, then a different instrument may be needed or the screening parameters changed. Servant leadership suggests that A. All staff members of the organization serve the leader. B. The leader serves all others in the organization. C. A hierarchical system of leadership is in place. D. Staff members are assigned specific tasks to assist the leader. The correct answer is B. The leader serves all others in the organization. The premise of servant leadership is that the leader is not meant to simply exercise power and make decisions, but to serve all those within the organization and/or community. Leadership is considered an altruistic endeavor. Thus, essential qualities of a servant leader include the ability to listen effectively to the input of others and to exercise empathy, always putting the organizational needs and greater good above personal needs. The leader needs to have a good sense of self-awareness and the ability to persuade and influence others. The Health Insurance Portability and Accountability Act, HIPAA, 1996, privacy rules allow unrestricted disclosure of patients. A. Past health history. B. Past payments for health care. C. Future plans for health care. D. De-identified health information. The correct answer is D. De-identified health information. Health information may be de-identified by a formal determination by a qualified statistician, or through removal of specific identifiers such as the name of the patient, family members, household members, and employers, as well as date of birth, social security number, other ID number, telephone number, and address. The PHMNP is serving on an ad hoc committee to make recommendations about process improvement and plans to begin by gathering data about the prevalence of mental health disorders, treatments, and costs. The organization that best provides this information is A. Agency for Healthcare Research and Quality. B. Substance Abuse and Mental Health Services Administration. C. Centers for Medicare and Medicaid Services. D. National Institute of Mental Health. The correct answer is D. National Institute of Mental Health. The National Institute of Mental Health collects a wealth of data. The 4 primary categories of data include prevalence. Subcategories include serious mental health illness by demographics, age, sex, race, specific disorders, use of services and treatment, and specific populations, such as inmates. Disability. Subcategories include disability and years of life lost. Suicide. Subcategories include rates, suicidality, and causes of death. Cost. Subcategories include estimates, payers, receivers, trends, and comparisons among the 5 most expensive medical conditions, which include heart conditions, cancer, trauma-related conditions, asthma, as well as mental disorders. When faced with an ethical dilemma in caring for a patient, the PHMNP should A. Share concerns with others, such as an ethics committee. B. Try to reach a conclusion independently. C. Discuss the matter with a trusted friend. D. Try to set the concerns aside. The correct answer is A. Share concerns with others, such as an ethics committee. When faced with an ethical dilemma in caring for a patient, the PHMNP should share concerns with others, such as an ethics committee, in order to reach a resolution. Personal bias can make trying to reach a conclusion independently difficult, as people are often unaware of their biases. Most organizations have ethics committees that are trained to deal with ethical issues. Trying to ignore an issue or to resolve it with the help of a close friend are not good solutions. The PHMNP has been asked to evaluate a confused and delusional patient with end-stage renal disease. The nursing diagnosis that the nurse practitioner enters into the care plan is A. Powerlessness. B. Ineffective coping. C. Disturbed thought processes. D. Hopelessness. The correct answer is C. Disturbed thought processes. If a patient with end-stage renal disease is confused and delusional, the nursing diagnosis that should be entered in the plan of care is disturbed thought processes. With end-stage renal disease, the body is unable to clear toxins from the blood. A number of factors can contribute to mental confusion, including hypertension, electrolyte imbalance, and acid-base disturbance. A patient taking an atypical antipsychotic medication developed dystonic reactions, including eye and neck spasms. The PHMNP prescribes A. Amantadine. B. Diphenhydramine. C. Propranolol. D. Clonazepam. The correct answer is B. Diphenhydramine. Dystonic reactions. Spasms of the eye, neck, tongue, back, and other muscles are common during early stages of treatment with antipsychotics, especially high-potency drugs administered parenterally and in high doses. The reactions may occur immediately or be delayed for a few hours or days. Dystonic reactions are rare after the first 3 months of treatment. The reactions usually subside with the administration of diphenhydramine, followed by oral administration. Benztropine may also be used to treat dystonic reactions. In a therapeutic milieu, the primary action of the PMHNP in helping patients to develop effective interpersonal skills is A. Role modeling. B. Explaining expectations. C. Setting boundaries. D. Providing consequences. The correct answer is A. Role modeling. The nurse practitioner models behavior that supports appropriate boundaries and helps patients learn appropriate responses. Interpersonal skills include showing respect, caring, managing conflicts, and being assertive, genuine, and honest. For example, if a patient is asked to introduce himself but states he is uncomfortable talking, the nurse practitioner might model acceptance by stating, "I'll appreciate your trying." When conducting examinations of patients, the PMHNP should keep in mind that the psychiatric diagnosis for which there are the most differential diagnoses is A. Schizophrenia. B. Conduct disorder. C. Bipolar disorder. D. Generalized anxiety disorder. The correct answer is D. Generalized anxiety disorder. Symptoms of anxiety are often very nonspecific and may occur in a multitude of other psychiatric and non-psychiatric disorders, and may also occur with drug toxicity and drug withdrawal. Many medications, including corticosteroids and bronchodilators, may cause anxiety. When using the learn, listen, explain, acknowledge, recommend, and negotiate model for cross-cultural healthcare, an important approach to the explain step is to A. Use simple language and avoid medical jargon. B. Use drawings, videos, and test results. C. Wait until the patient asks for an explanation. D. Explain to family members first whenever possible. The correct answer is B. Use drawings, videos, and test results. Providing concrete information or demonstrations helps patients to better understand, especially when cultural differences result in perceptions of illness that may be at odds with Western beliefs. When addressing a group of older adults at a senior citizens center about mental health, the neuroprotective strategy that the PMHNP should recommend as valuable for almost all older adults is A. Stopping ingestion of alcohol. B. Drinking a daily glass of wine. C. Doing physical exercise. D. Increasing social interactions. The correct answer is C. Doing physical exercise. Exercise promotes neuroplasticity and brain functioning. Patients should also be encouraged to stay mentally active, such as through learning new skills and doing mental exercises, such as Sudoku. In a research project the PMHNP is conducting, some patients are excluded from the project, so, instead of randomized subjects, the subjects are highly selected. This type of selection could produce results that have primarily A. Generalizability. B. Replicability. C. External validity. D. Internal validity. The correct answer is D. Internal validity. For various reasons, some people may be excluded from a study so that instead of randomized subjects, the subjects may be highly selected. Therefore, when data which have internal validity are compared with data of another population in which there is less or more selection, results may be different. The selection of subjects, in this case, would interfere with external validity. Part of the design of a study should include considerations of whether or not it should have external validity, or whether there is value for the institution based solely on internal validation. The PHMNP sees a patient with schizophrenia taking risperidone. The patient had an electrocardiogram, ECG, performed recently that the nurse practitioner is reviewing. The PHMNP knows the ECG change that should be monitored for with risperidone is A. Elevated ST segment. B. Prolonged QT segment. C. Depression of ST segment. D. Absent P wave. The correct answer is B. Prolonged QT segment. The ECG change that should be monitored with risperidone is a prolonged QT segment. If this occurs, the patient may require an alternative medication. Other cardiovascular adverse effects associated with antipsychotics include postural hypotension, most common with low-potency antipsychotics, and arrhythmias and palpitations, associated with higher doses and combinations of drugs. Patients on antipsychotics should have routine monitoring of cardiovascular status, including an ECG. The PHMNP is conducting a problem-focused office visit with an established patient in order to titrate medication. The number of elements of the psychiatric exam that must be included for CMS billing purposes is A. 2 to 4 elements. B. 1 to 5 elements. C. 1 to 8 elements. D. 11 elements. The correct answer is B. 1 to 5 elements. If the PHMNP is conducting a problem-focused office visit with an established patient in order to titrate medication, the number of elements of the psychiatric exam that must be included for CMS billing purposes is 1 to 5. Elements of the psychiatric exam include speech, thought processes, associations, abnormal or psychotic thoughts, judgment or insights, orientation, recent and remote memory, attention and concentration language, fund of knowledge, and mood and effect. After a fire destroys a patient's home, the patient tells the PHMNP, "I've lost everything that's important to me. I have no money to rebuild. I don't care about anything anymore because everything is hopeless." The response that has the highest priority is A. Let's talk about the things you still have. B. Do you have family and friends who can help you? C. Are you thinking about killing yourself? D. What can I do to help you cope? The correct answer is C. Are you thinking about killing yourself? The response that has the highest priority is, are you thinking about killing yourself? Suicidal ideation is common when people are distraught and overwhelmed and feel their situations are hopeless, so this should be addressed directly. According to Kotter's model for organizational change, the first phase involves A. Establishing a sense of urgency. B. Developing a vision for change. C. Empowering broad-based change. D. Generating short-term gains. The correct answer is A. Establishing a sense of urgency. The primary means of establishing urgency is to draw attention to a problem through the collection and dissemination of data. Then, A coalition needs to be formed of individuals sharing similar goals. This group develops a vision for change and communicates the vision to others. Next, individuals must be empowered to make changes, meaning that they have responsibilities as well as accountabilities. Sources of power in an organization usually derive from 1. Authority, 2. Reward, 3. Expertise, and 4. A. Luck. B. Deceit. C. Enthusiasm. D. Coercion. The correct answer is D. Coercion. Authority, usually related to position in the hierarchy, administrator, supervisor, team leader. Reward, usually derived from administrator and supervisors and include increased salary, benefits, and recognition. Expertise, special knowledge that sets an individual apart and allows the person to exercise some degree of authority, such as a PHMNP. Coercion, the ability to require others to do or say something, such as occurs when a manager makes an assignment or passes judgment. The cytochrome P450 enzyme that metabolizes approximately 50% of current drugs is A. CYP1A2, B. CYP2C9, C. CYP2D6, D. CYP3A4. The correct answer is D. CYP3A4. Many commonly used medications, such as alprazolam, Xanax, sildenafil, Viagra, and carbamazepine, Tegretol, are CYP3A4 substrates. However, many other common drugs are CYP450 inhibitors or inducers, which affect the metabolism of the substrates. If a substrate is given in conjunction with an inhibitor, the metabolism of the substrate is slowed, allowing drug levels to increase to toxic levels. A patient taking a selective serotonin reuptake inhibitor, SSRI, antidepressant, sertraline, has developed sexual side effects, including anorgasmia and reduced libido. The PHMNP recognizes the initial step in resolving this problem should be to A. Change to a tricyclic antidepressant. B. Change to a different SSRI. C. Decrease dosage of the SSRI. D. Administer an antidote, such as sildenafil or bethanechol. The correct answer is C. Decrease dosage of the SSRI. The first step is to decrease the dosage of an SSRI, but it may take a few weeks before improvement is seen. If this is unsuccessful, try a different antidepressant, such as an SSRI with a lower rate of sexual side effects or a different class of antidepressant. Antidotes, such as sildenafil or bethanechol, may be useful for some patients. The relationship between the total loading dose of an administered drug and the serum concentration refers to the A. Absorption, B. Distribution, C. Clearance, D. Metabolism. The correct answer is B. Distribution. Distribution. The volume of distribution is the relationship between the total loading dose of drug administered and the serum concentration, volume of body fluid required to dissolve the amount of drug found in the serum. When disseminating evidence regarding adverse effects associated with a medication to a large number of patients and families in a widespread area, the best method is likely A. Mail or email. B. Telephone. C. Personal visit. D. Group meeting. The correct answer is A. Mail or email. With large numbers of patients, telephone calls may be too time-consuming, especially because many people screen calls so the call goes to voicemail. The best method is likely regular mail in addition to an email notice to make sure that the message is received. A patient with a history of panic attacks is admitted to the emergency department with severe chest pain and shortness of breath. The PHMNP is reviewing the patient's workup that the ER physician ordered and recognizes that the cardiac enzyme test that was ordered to best rule out a myocardial infarction is A. CKMB, B. Myoglobin, C. Troponin I, D. Troponin T. The correct answer is C. Troponin I. Troponin I is the most important cardiac enzyme test, as troponin I and T are released when the heart muscle is damaged. Troponin levels begin to increase within 3 to 6 hours of cardiac damage, and peak in 14 to 20 hours. If the PHMNP wants to follow two groups of adolescents, one group with a parent with substance abuse and the other a control group of adolescents whose parents are not substance abusers. To determine the incidence of substance abuse in each group, the most appropriate study design is A. Randomized control trial, B. Case control, C. Quasi-experimental design, D. Cohort. The correct answer is D. Cohort. The most appropriate study design is a cohort study. The cohort study is an observational study that follows groups over a period of time to determine the incidence of a problem or the relationship between a variable and an outcome. A patient is to be included in a clinical research study. The first priority under human subject protection is A. Explain the purpose of the clinical research. B. Ensure that the patient meets criteria for the study. C. Obtain informed consent. D. Document patient's inclusion in the study. The correct answer is C. Obtain informed consent. The FDA's 21 CFR Parts 50 and 56 regulate protection of human subjects and state that any researcher involving patients in research must obtain informed consent. The elements of this informed consent must include an explanation of the research, the purpose, and the expected duration, as well as a description of any potential risks. Potential benefits must be described, as well as possible alternative treatments. In developing evidence-based guidelines to promote compliance with a treatment regimen, the factor that should carry the most weight in developing new policies is A. Best practices identified through literature review. B. Nursing staff preferences. C. Physician preference. D. Cost effectiveness. The correct answer is A. Best practices identified through literature review. Best practices identified through literature review should be the most important when developing evidence-based guidelines, as preferences are often based on subjective observations rather than objective observations. Cost effectiveness should not be the primary concern, as spending more to prevent a problem may save money in the long term. The nurse practitioner is engaged in research with a screening tool to predict patients with schizophrenia who will become non-compliant with treatment. The results at the end of 24 months show that out of 200 patients, 92, 46%, were non-compliant and 88 were correctly identified, 96%, 108 remained compliant, but there were 27 false positives, 25%, for non-compliance among this group. The screening test has A. High sensitivity and high specificity. B. High sensitivity and low specificity. C. Low sensitivity and low specificity. D. Low sensitivity and high specificity. The correct answer is B. High sensitivity and low specificity. The screening test has high sensitivity because it correctly identified most patients, 96%, with the condition being measured, non-compliance, with a low rate of false negatives. However, a rate of 25% false positives among the compliant group indicates the test has low specificity. High sensitivity tests have low rates of false negatives, and low sensitivity tests have high rates of false negatives. High specificity tests have low rates of false positives, and low specificity tests have high rates of false positives. An example of an interaction that promotes a therapeutic alliance between the patient and the PHMNP is the A. Patient and nurse share mutual experiences. B. Patient and nurse discuss random topics. C. Patient and nurse promise to maintain secrets. D. Patient and nurse discuss goal setting for the patient. The correct answer is D. Patient and nurse discuss goal setting for the patient. The PHMNP must be aware of professional boundaries and avoid sharing mutual experiences, discussing random topics, and maintaining secrets to promote a therapeutic alliance between the patient and the mental health nurse practitioner. A Hispanic patient is admitted to the unit and the PHMNP is doing the admission history, but the patient speaks very little English. The nurse practitioner should A. Ask the patient's 10-year-old son, who is fluent in English, to translate. B. Use gestures and pictures to supplement questions. C. Arrange for a translator. D. Ask the patient's wife, who speaks fair English, to answer the questions for her husband. The correct answer is C. Arrange for a translator. The nurse practitioner should arrange for a translator for the patient, as children should not be used as translators due to their lack of vocabulary and understanding. Additionally, the patient may have kept information from the family. The most essential protective strategy for the PHMNP to employ to reduce the risk of legal action is to A. Meet or exceed the standard of care. B. Maintain malpractice insurance. C. Document all patient care promptly. D. Avoid serving litigious patients. The correct answer is A. Meet or exceed the standard of care. The most essential protective strategy for the PHMNP to employ to reduce the risk of legal action is to meet or exceed the standard of care. The nurse practitioner must be competent and up-to-date with the latest treatments. The nurse practitioner should also be knowledgeable about the state's Nurse Practice Act and the scope and standards of practice, the ANA's Code of Ethics, and the organization's policies and procedures. A patient with a history of narcotics abuse has been taking lorazepam, Ativan, for anxiety but presents with lethargy, dizziness, headache, marked alteration in consciousness, respiratory depression, and ataxia. Her friend states the patient was found 2 hours earlier with the empty prescription bottle. The PHMNP should prescribe A. Gastric emptying and charcoal. B. Charcoal, concentrated dextrose, thiamine, and naloxone. C. Charcoal, concentrated dextrose, and flumazenol. D. Gastric emptying, charcoal, and naloxone. The correct answer is B. charcoal, concentrated dextrose, thiamine, and naloxone. The nurse practitioner should suspect co-ingestion and recommend charcoal, concentrated dextrose, thiamine, and naloxone for gastric emptying. Flumazenil is contraindicated in the presence of increased intracranial pressure. The PHMNP notes that a patient with frontotemporal dementia has difficulty with executive functioning, suggesting damage to the A. Prefrontal cortex, B. Premotor cortex, C. Orbitofrontal cortex, D. Precentral cortex. The correct answer is A. Prefrontal cortex. If the PHMNP notes that a patient with frontotemporal dementia has difficulty with executive functioning, this suggests damage to the prefrontal cortex, which lies behind the forehead. Executive functions include the ability to plan, establish goals, and regulate behavior. Patients may have lack of impulse control and the ability to suppress socially unacceptable speech or behavior, as well as impaired short-term memory and lack of empathy for others. Ensuring that a patient has given informed consent and understands his or her rights and all of the risks and benefits of a procedure or treatment supports the ethical principle of A. Beneficence, B. Non-maleficence, C. Justice, D. Autonomy. The correct answer is D. Autonomy. Autonomy is the right of the individual to make decisions about their own care. Beneficence is for the purpose of benefiting another person. Non-maleficence is to provide care in a manner that does not cause direct harm to the patient. And justice is the distribution of healthcare benefits to the members of society. When assessing factors that affect readiness to learn, the PHMNP recognizes the patient's cultural background and personal goals relate to A. Physical factors, B. Mental, emotional status, C. Experience, D. Knowledge, education. The correct answer is C. Experience. A person's experience with learning is affected by their ability to cope with changes, personal goals, motivation to learn, and cultural background. Lack of English skills can make learning difficult and prevent people from asking questions. The patient or family's readiness to learn should be assessed and indicated when they ask questions or show an interest in procedures. The PHMNP is conducting a group with patients recovering from trauma. An action or intervention that may be viewed as re-traumatization is A. Utilizing a confrontational approach in the group, B. Encouraging a patient to participate in treatment plans, C. Screening for trauma history prior to inclusion in the group, D. Enforcing rules of conduct in the group consistently. The correct answer is A. Utilizing a confrontational approach in the group. Re-traumatization can be caused by using a confrontational approach in a group, which can be traumatizing to victims of abuse. Patients should be encouraged to participate in treatment plans and screened before admission, and rules of conduct should be enforced consistently to reduce anxiety. In the informal negotiations that are part of collaborating and reaching consensus, when both parties make concessions in order to reach consensus, but neither side is really happy with the result, this approach to negotiation is A. Accommodation, B. Avoidance, C. Compromise, D. Collaboration. The correct answer is C. Compromise. Both parties make concessions, But this can result in decisions that suit no one, so compromise is not always ideal. According to the General Adaptation Syndrome, CELI, which comprises alarm, resistance, and exhaustion, an example of reaction to stress in the resistance stage is A. Levels of neurotransmitters and hormones return to normal. B. The hormonal system becomes activated to produce more hormones. C. The body becomes exhausted and unable to sustain the stress response. D. Chronic health problems associated with stress arise. The correct answer is A. Levels of neurotransmitters and hormones return to normal. CELI's General Adaptation Syndrome consists of 3 stages: alarm, resistance, and exhaustion. Alarm involves the fight or flight response, while resistance involves the body trying to recover the normal status of the cardiovascular, hormonal, and neurotransmitter systems. Exhaustion can lead to chronic illnesses. If a patient takes 8 aspirin and promptly tells family members about taking an overdose, and the family believes that this is a suicide attempt, but the patient did not actually intend to die, but rather to get attention, this act would be classified as A. Suicide ideation. B. Suicide threat. C. Suicide attempt. D. Suicide gesture. The correct answer is D. Suicide gesture. Suicide gestures are actions that do not result in harm to the individual, while suicide ideation is thoughts or fantasies about committing suicide, suicide threat is verbal or written statements of intent, and suicide attempt is actual actions taken to commit suicide, resulting in minor or major injury or threat to health. When assessing a patient's cranial MRI, the PHMNP notes that the report indicates the patient has significant atrophy of the hippocampus. Based on this finding, the nurse practitioner should expect that the patient will have the A. Inability to form new long-term memories. B. Inability to retrieve existing long-term memories. C. Inability to form short-term memories. D. Inability to communicate verbally. The correct answer is A. Inability to form new long-term memories. The PHMNP should expect that a patient with significant atrophy of the hippocampus will not be able to form new long-term memories, but may be able to retain existing ones and form short-term memories. When evaluating literature and information to determine the level of evidence, the category that indicates that information has supporting evidence from some studies, has a good theoretical basis, and is strongly recommended for implementation is A. Category 1A. B. Category 1B. C. Category 2. D. Category 3. The correct answer is B. Category 1B. Category 1B, supporting evidence from some studies, good theoretical basis, and strongly recommended for implementation. When communicating with a patient, the statement by the PHMNP that exemplifies therapeutic communication is A. You should try not to worry. B. Don't worry. Everything will be fine. C. Why are you so upset? D. I'd like to hear how you feel about that. The correct answer is D. I'd like to hear how you feel about that. Therapeutic communication allows a patient to explore a topic, while non-therapeutic communication includes meaningless cliches, providing advice, and asking for an explanation of behavior that is not directly related to patient care. As part of the normal aging process, changes in neurotransmitters usually occur, including A. Decreased serotonin. B. Increased epinephrine. C. Decreased glutamate. D. Increased acetylcholine. The correct answer is A. Decreased serotonin. Serotonin is an important neurotransmitter that helps regulate body temperature, eating and sleeping patterns, and mood. As part of the normal aging process, decreased levels of serotonin can lead to depression. Selective serotonin reuptake inhibitors, SSRIs, target serotonin and prevent its reuptake, making it more available to function as a neurotransmitter. When treating anxiety in an older adult, 65 years or older, the type of medication that is preferred is A. A short-acting benzodiazepine. B. A long-acting benzodiazepine. C. A tricyclic antidepressant. D. A 13-adrenergic agent. The correct answer is A. A short-acting benzodiazepine. Short-acting benzodiazepines, such as lorazepam or temazepam, are usually well tolerated for geriatric patients, while tricyclic antidepressants and 13-adrenergic agents may cause adverse effects. Long-acting benzodiazepines may result in confusion in elderly patients, and some people may respond to SSRIs or low-dose antihistamines. Younger adults may benefit from a wider range of drugs. A patient is taking clozapine, an antipsychotic medication, and has been a chain smoker, 2 or more packs per day, for many years but is enrolled in a smoking cessation program and has not smoked for the past week. If the patient is successful at quitting smoking, the patient may A. Have increased adverse effects. B. Have no effect from smoking. C. Require a higher dosage than normal. D. Require a lower dosage than normal. The correct answer is D. Require a lower dosage than normal. The NP should expect that the patient will require a lower dosage than normal. The components of tobacco smoke affect liver enzymes, often speeding up metabolism and resulting in the need for a higher dose to achieve the same serum level. If the patient stops smoking, then dosages often need to be adjusted downward. A patient with a history of anxiety, treated with lorazepam during acute episodes, and alcoholism is prescribed metronidazole for bacterial vaginosis. The PHMNP should caution the patient to A. Avoid taking lorazepam during treatment. B. Avoid any intake of alcohol. C. Limit alcohol to 1 serving daily. D. Take lorazepam during treatment. The correct answer is B. Avoid any intake of alcohol. The PHMNP should caution the patient to avoid any intake of alcohol because combining the drug with alcohol may result in accumulation of acetaldehyde. Metronidazole inhibits the action of the enzyme aldehyde dehydrogenase, which metabolizes acetaldehyde. This can result in acute alcohol intolerance syndrome. Which of the following is a tool that the PHMNP can use to provide a client's self-assessment of functional health and quality of life issues? A. Patient Health Questionnaire. PHQ. B. Post-Deployment Clinical Assessment Tool, PDCAT. C. Barthel Index. D. Health Status Survey, SF36. The correct answer is D. Health Status Survey, SF36. The Health Status Survey, SF36, and Patient Health Questionnaire, PHQ, are used to assess functional health and quality of life issues, while the post-deployment clinical assessment tool, PDCAT, is used to screen returning military for mental health and substance abuse problems. The Barthel Index assesses the functional ability of older adults. When the NP interviews a patient with chronic pain from metastatic cancer and suspected suicidal ideation, the patient states, "I can't stand this pain anymore. I should just shoot myself and be done with it." The best initial response is A. "I understand why you feel that way. I'll ask the doctor to prescribe an antidepressant for you." B. "I'm sure you don't really mean that." C. "Let's work together to find better ways to manage your pain." D. "Do you have a plan to hurt yourself?" The correct answer is D. Do you have a plan to hurt yourself? Pain appears to be driving this patient to suicidal ideation, so the best response is to first directly address the comment to determine the severity of suicidal ideation by asking if the patient has a plan to hurt himself. After the immediate risk assessment, the NP should find ways to alleviate the cause of this patient's distress by offering to work together to find better ways to manage the pain. Many people fear pain more than death, and patients have a right to be free of pain at the end of life. The NP should assess the type, frequency, and duration of pain and current pain management. In some cases, a change to a stronger medication, such as an opioid, or the addition of adjuvant medications may be indicated. Suicidal ideation should be reported to the attending physician and the caregivers should be alerted. A data-heavy presentation with much raw data about progress in performance improvement is most appropriate for A. Administration. B. Nursing staff. C. Patients. D. All groups. The correct answer is A. Administration. A data-heavy presentation about progress in performance is most appropriate for administration because administrators are in a position to make decisions and need raw data. However, the presentation should be modified for others. For example, graphs and charts may be used instead of raw data. The PHMNP should assess audience characteristics, including occupation, gender, and education, so that information can be tailored for the audience. A nurse on the psychiatric unit uses another nurse's password to access an acquaintance's electronic health record, EHR, and obtain personal information about the patient. This type of data misuse is classified as A. Identity theft. B. Unauthorized access. C. Privacy violation. D. Security breach. The correct answer is C. Privacy violation. Unauthorized access. Although EHRs and computerized documentation systems are password protected, providers sometimes share passwords or unwittingly expose their passwords to others when logging in, allowing others to access information about patients. Other forms of data misuse: identity theft, obtaining identifying information, such as social security numbers and credit card numbers, to pose as the other person or access his or her assets. Privacy violations, sharing private information with others, such as family or friends. Security breach, lack of implementation of proper security safeguards and security design, especially when various business associates, such as billing companies, have access to private information, which they misuse. A 66-year-old male patient with Parkinson's disease has been controlled with levodopa, but has developed the on-off phenomenon with fluctuating response to the levodopa. Treatment that may be indicated to reduce the breakdown of levodopa is A. Doubling the dose of oral levodopa. B. Adding entacapone, Comtan, a COMT inhibitor. C. Stopping treatment with levodopa. D. Adding haloperidol, Haldol. The correct answer is B. Adding entacapone, Comtan, a COMT inhibitor. The COMT enzyme metabolizes levodopa, so a COMT inhibitor slows metabolism to minimize the drug's wearing off so that blood levels are maintained until administration of the next dose of levodopa, reducing the on-off phenomenon. Patients receiving neuroleptics should be monitored routinely with the A. Mini Mental State Exam, MMSE. B. Minicog. C. Trail-making test. D. Abnormal Involuntary Movement Scale, AIMS. The correct answer is D. Abnormal Involuntary Movement Scale, AIMS. AIMS detects and evaluates tardive dyskinesia, the trail-making test assesses brain function, and the MMSE and the minicog both assess cognition and involve memory tasks, such as counting backward and remembering words. They are also used to diagnose and evaluate dementia. The PHMNP supports a recovery-oriented approach to a treatment program for substance abusers. A prime element of a recovery-oriented approach is A. Focus on a single treatment plan for all participants. B. Treatment must always be voluntary. C. Recognition that recovery is nonlinear. D. The program should be community-centered. The correct answer is C. Recognition that recovery is nonlinear. A recovery-oriented approach to treatment recognizes that recovery is nonlinear and requires multiple episodes of treatment. It is person-centered and includes family, friends, and community agencies, and does not need to be voluntary. Staff members ask the PHMNP how to deal with a 67-year-old patient with dementia who repeatedly removes his clothing and requests sexual favors. The most appropriate response is to tell the staff to A. Supervise, observe, and distract the patient. B. Restrict the patient to his room. C. Provide antipsychotic medication. D. Reprimand the patient. The correct answer is A. Supervise, observe, and distract the patient. Patients with dementia or cognitive impairment may exhibit inappropriate sexual behavior, such as undress, masturbate, request sexual favors, use obscene language, and behave aggressively. Medication does not help to manage this behavior, which is best managed by supervision, distracting the patient, or observing for patterns. A patient who has been treated for depression with an MAO inhibitor is showing inadequate response and adverse effects, so the PHMNP wants the patient to begin taking an SSRI. The nurse practitioner should A. Stop the MAO inhibitor and immediately start the SSRI. B. Stop the MAO inhibitor and wait at least 14 days to start the SSRI. C. Continue the MAO inhibitor and add the SSRI in increasing doses over 1 month. D. Stop the MAO inhibitor and wait at least 2 months to start the SSRI. The correct answer is B. Stop the MAO inhibitor and wait at least 14 days to start the SSRI. The PHMNP wants the patient to begin taking an SSRI, but the nurse practitioner should stop the MAO inhibitor and wait at least 14 days to start the SSRI, as taking it with a medication that increases serotonin levels may cause serotonin syndrome, which can lead to fever, chills, anxiety, and confusion.